Okay, now the Health Minister, Joe Phaahla, is about in a short while address or brief the media after he had an internal briefing with hospital officials where he's visiting the victims of the fire that has killed 74 people. And that's, of course, at the Helen Joseph Hospital. That's Dr. Phaahla for you. Let's take a listen.
The purpose of my being here was really to get an appraisal in terms of how our health facilities are coping after the disaster, the fire disaster, which happened in the central Johannesburg early yesterday morning. Now, in terms of the briefing which I've got and which we discussed, what is encouraging is the fact that thus far our facilities are coping with the impact of the disaster. It's a very tragic situation where you find a situation where a disaster happens, and the aftermath of which is that there are more, almost 50-50 fatalities, and those who ended up being able to be treated in our facilities. Very high. I mean, it's a very high proportion. When you have a disaster and you're standing at just almost just under 50% fatality, that's a real disaster. Because in most cases you would find that maybe something happens and maybe there's a 10%, 5% people who died. The majority are being treated, in the hospitals. So the nature of the injuries of those who survived and were able to be admitted, the nature of the injuries, as also we're just seeing one patient here, it's a smoke inhalation, as you know, because of the fire. Those are those patients who are still in the hospitals, in the about 5 hospitals here around Johannesburg. It's mainly smoke inhalation. And then, of course, the bigger portion is broken limbs. Broken limbs, including, in some cases, 2 patients who have broken spine, broken back, which affect the spine. So some of, fortunately, it doesn't look like many, but it's still 1 too many. I mean, 2 too many of the broken spines. The large majority, it's broken long bones, what you call. So in other words, arms and legs, and most of those already have either been operated or they are already getting ready to be operated. So that's really the balance. Quite a number of patients, more than 50%, I think, all in all, we've got the actual numbers. Just over, I think, just under 90 patients who were attended to. Close to 50-something have already been discharged. I think Mr. Mudiwa will be able to give you the actual numbers. Just over 30 who are still being attended in the various hospitals, including here at Helen Joseph, at Chris Hani Bara, Charlotte Macleke, and a number of other 2 or 3 hospitals. So the message which we can say, we thank our emergency medical services people who were on the spot. It's just a pity that in terms of how the whole disaster unfolded, it's really something which, even with the best of equipment, the best of, people with advanced life support, life-saving emergency services, there wasn't really much which could be done, because it's clear that people were just trapped. Because when you get a situation where you've got a fire, but I mean, even here at Helen Joseph, and when I get the report from Chris Hani, from Charlotte, it's quite a surprising situation, which is a real tragedy and travesty, that there are very few of those survivors who are admitted for burns. There was a fire, but there are very few people. So anybody who got burned couldn't escape. And that's why you've got so many fatalities. Only those who could be able to run and get some escape already with the smoke than are those who are in intensive care being cared for even here. The large majority are people who, because they couldn't find an escape route, have to jump from the windows. And that's why most of the people who are still in hospitals, even though we said it's smoke and inhalation and also broken bones, large majority is the broken bones, because people were trying to, they were escaping from 5th floor, 4th floor, and so on. So the big problem, of course, as which we are left with, is the fact that we've got 76 fatalities, out of which 74 were those who, as the reports have been given from yesterday, were demised on the premises, and then 2 passed away, already in hospital. Only 2 are those who demised in hospital. Now, the big number of the 74, as you know, the big issue now is identification, and that's a big problem. You would have heard already that out of the 74, only 12 have been identified. The other 62 still have to be. Now, the big problem here, even though the technology is there working with the police in terms of DNA, but when you don't know who was in the building, you don't have a list. It's unlike the usual problems which our teams in forensics deal with, where there has been maybe a bus accident, a kumbi. There have been such situations where a kumbi full of people explodes, and people, people burn beyond recognition. The difference here is, in that situation, you have some indication, and that's what helps. I know in most of the taxi ranks, they take names, so you are able to know who was inside the vehicle. But in this case, the biggest problem is the fact that we don't know who was inside the building. There's virtually very limited, if any, information. So the DNA forensics are doing the DNA testing. At the current moment, I'm told that some families have come forward to say, we did have relatives, so-and-so was in the building, and those are being taken samples to compare with the tissues which are being taken from the bodies. But the biggest challenge is the fact that the majority of those, if you only have just under 20 of families which have come forward, and you are dealing with over 62 unidentified remains, there's still a huge backlog in terms of people who are coming forward. And there's no records in terms of who was in which part of the building. So even when they do the tissue and do the DNA, because to know who that person is, you then need to compare with somebody and then say they are matching. So as I'm going towards conclusion, our call really to all people who suspect or know, because first of all, we know there are people who know who was in the building. The landlords and those who have been collecting rent and managing that situation. It will be very helpful if they can come forward, provide the information which they have, because the mere fact that people were paying rent, it means somebody has some records to say who was in the building. So we are appealing to those to find a way, even if, I would even say if it's anonymous, even if they were to approach the anonymous, police numbers, or even from, we also at the National Department do advertise a call center where people can raise issues about COVID, about any other. So even if people can use those numbers just to provide the information which they have, either to health, Gauteng, or even on our national hotline, or the police hotlines, because we do understand that some of those may, because they were running an illegal operation, they will be fearing, identification. So even if they were to come forward with that, it would be very helpful, because otherwise it's really mind-boggling as to, without that information, the DNA samples will be taken. There will be a sequencing in terms of this is the DNA sequence of this body, but then you don't know to compare with, there must be a relative with a person with whom you can be able to compare. So that's really our call to say, anybody who has any information, please come forward so that it will be helpful to complete this process. If you are afraid, use any means, including the hotlines, to provide information at your disposal. Thank you very much.
Minister, you are live on eNCA. My name is Moluko Moloto. I'm sorry, Mudiba, we live. I just want to understand because you are just updating us, there are 2 more deaths, 2 who died in hospitals. What is the condition of those who are still in hospital? Do you still have people who perhaps are in ICU? And looking at the fact that you have had 2 who died in hospital, your assessment, do you expect that perhaps given the seriousness of their injuries or conditions, chances are the death toll might increase?
Well, from the feedback, we have done an analysis with the team in terms of the clinical situation, including, as I said, even here at Ellen Joseph. The report which I've got so far, it's not suggesting that we, amongst those who are being treated now, except of course that we have lost 2, those were the more serious. The large majority of just under 40 who are still in hospital are very stable. They are in very stable conditions. They are not classified as being, in very critical condition. So that's the tragedy of this situation, as I've said, that we're not able to save more lives. So it was either you get caught in that and burned to death, or else those who survived. If you look at the fatality rate from those who survived, 2 out of about 90. It's still two lives too many, but it tells you that those who survived, and as the report indicates, are mostly very stable. And life, it's unpredictable when you're dealing with medical situation, but at this stage, we are not highly alarmed about those who are still remaining under treatment. More than 50% of those who sought medical treatment have already been discharged.
You already have a conundrum of having to identify relatives and families of the deceased, majority of those who passed on. And some are in hospital. I'm not too sure whether you've been able to identify families of those who are in your hospitals and other facilities. But if you don't succeed in identifying the families of the deceased, what would be the way forward, therefore?
Well, that's a matter which, between ourselves in health and the police, and also social development, will have to be discussed as we go forward. At this stage, it's still early. We're hoping that there will be more information coming forward. There will be more people coming forward, so that as the forensics do the DNA on the bodies, hopefully there will be more people coming forward to say, I'm missing a relative who was in that vicinity. So in the event that after a month, let's say, the DNA has been, the results on all the bodies have been done, they've got all the sequencing of the DNAs, but there are many who have no match. There is nobody coming forward to compare. Then I think there's guidelines in terms of both from forensics, from the health side, from the police, certain periods for which you have to wait. We continue at this stage we'll still make the calls. When that comes, we'll have to follow the relevant procedures in terms of, as it happens when somebody passes away unidentified, and you might have to just take the records, and then in the ultimate, if it comes to that situation after a couple of months, it might be unavoidable that some of the remains may have to be buried, but keep the records. so that if a few months later somebody emerges and says, on that incident I lost a relative, then you can be able to, because you would be having the records of the DNA, you can then compare, you can do sample from that person who says it was my relative, and then you can be able to then follow up. But we hope that we don't get there. We hope that all the remains will finally be identified.
We hear you talking of doing DNA tests, yet we also know that in our country we are often told that the DNA laboratory or forensic laboratory is overwhelmed. How are you expediting this process? Does it mean, therefore, that you are prioritizing it perhaps over other cases that are in the queue?
Well, there is backlog. There's been improvement. There has been a lot of improvement in terms of the forensic laboratories to do DNA testing. But this is also, because of the nature of the disaster and its complication. It's not that the others are pushed back completely, but the laboratory is also making sure that they can move quicker. This is a matter which we will need to, again, also, as I said with my colleague, Minister of Police, will also look at. It's not new. It's not a new situation. We were just discussing here that when we had Pastor Joshua disaster from Lagos, among the things which we had to do at the time, working together, was also to seek some further assistance from some other, private laboratories, which were able to also add capacity. We are not yet there now, but that's a matter which we'll look at if it proves that it's quite a huge pressure on our laboratories.
We'll take SABC, they're also live as well. We'll just take some questions from them.
Minister Patricia Fasahi from the SABC, taking the sensitivity of this whole tragedy into consideration, often we hear of the mortuaries, the state mortuaries having challenges. What's being done to make sure that there are no challenges, to in particular preserve the integrity of those bodies so that the DNA testing process can actually go smoothly?
Well, maybe just on that part, but I'll also ask the MEC as the custodian of the mortuaries here in Gauteng to say something. Remember that in this case, we're talking, there is no risk in terms of the bodies which have been burned, in terms of it's not like when you're dealing with fresh bodies where if the conditions deteriorate and so on, there might be difficulties. Here, there was a fire. The reason why you can't identify is because you're just depending on certain tissues which remain. So there is no risk in terms of the deterioration of the actual remains from which you are extracting the samples to test. But of course, there is pressure. The longer it takes, there is pressure on the state mortuaries. So in terms of that's why working together with the forensic laboratories, we would want this process to be speeded up. But I know that the MEC and the team are already just addressing the issue of making sure that they can, create more capacity so that they can be able to, to deal with the normal pressure which are there. But maybe the MEC can just make a comment on that.
Thank you, Minister. Okay. Thank you, Minister. I think you are correct in terms of the capacity that we have now, which it was not there before. We've beefed up that capacity in our mortuaries, and we have even some of the doctors that, in fact, not even last week, HOT was employing 2 other doctors that must assist us in our mortuaries, working very closely then on this issue of forensic with the Department of Community Safety in the province and the police. So everybody is on board on this. And this one, even if we're pushing the backlog that we're having now, we will not stop other cases that we're supposed to do. Because I think your concern is that we'll stop because of the disaster that has happened. We'll still continue with the work because we've beefed up that security. But again, we have digital fingerprints now that we're having. We'll go for that option in areas where it's going to be easier for us to do those biometrics, and the team already is on site. Even here in the hospital, there was a patient that we couldn't identify because we didn't have documents, but we had to bring the team from forensic again to do digital fingerprints, and we know that person, where the person comes from now.
MEC, and I think this is the question that I asked the minister, but I am taking advantage of the fact that you are in the province and you would have knowledge. The exact number of patients who are in hospital. The minister mentioned over 30, and at some point I think he mentioned 40. If you can just clarify that, but also as to, do we know the relatives of these people who are all in hospital?
33 patients who are still in hospital, yeah.
How many in ICU?
There are not many. Do you have them?
It's two.
Only two.
Only two at the ICU.
Do we know whether there are children among those who are still in hospital and maybe elderly who are frail?
We have children at Charlotte Maxeke. It's only two, but they are not critical, even those children. The other one has been discharged because there were three. And then here at Rahima Musa, we have one child, and even that one is not critical. At Para, we don't have children. At Southern, they were all checked and then they were released.
All right.
Okay. Thank you, colleagues. I'm not sure because the other colleagues did not get a chance. Are you fine? Okay. No. Thank you very much. We are going to proceed, I know, with the MEC to go to the Deep Kloof mortuary. You are welcome to join. I know it's been a long day for yourselves, but if you are welcome to also join us there, just to go and assess the situation at the moment, because there's been families that have been assisted on the site.
And what is the situation?
That's the end there of that briefing by the Minister of Health, Dr. Joe Phaahla, joined by the MEC of Health here in Gauteng, and an announcement being made by department officials that they are now on their way to the Chris Hani Baragwanath Hospital in Soweto, where other victims of yesterday's fire in Johannesburg have been hospitalized. Just an update, if you've just joined us, Minister Phaahla confirming that in addition to the 74 people whose remains were recovered from that inferno, 2 other people have died in hospital. This means now that the death toll, as we speak to you after the minister's briefing, stands at 76 people dead. And he said more than 50% of people who sought help in hospitals yesterday have now been discharged. And those who remain, who are somewhere below 40, are in a very stable condition at this stage. We'll pick up a little bit later with Muloko Moloto for other details as we continue to bring you more about the aftermath of this devastating fire in downtown Johannesburg yesterday.